It turns out the vast majority of people with low back pain do not need surgery. Acute low back pain or low back pain for less than 3 months or so will improve on its own no matter what you do in 90% or more of cases. As a result, we take a relatively hands-off approach to acute low back pain. We tend to avoid getting unnecessary imaging of the spine. We encourage people to avoid bed rest. We encourage activity and sometimes physical therapy. Oftentimes we'll recommend anti-inflammatory drugs, but we really don't encourage surgery for acute low back pain. That's because, one, it's not necessary, and two, it doesn't work.
Our job is to make sure that there's not anything harmful going on, make sure you don't have a disc herniation that's pressing on a nerve. Those kinds of things do get better with surgery. But back pain that kind of waxes and wanes generally doesn't get better with surgery. And most of the time we want to teach people to take care of themselves so that they know what to do, so that they don't need to come in and be dependent on somebody else taking care of them. It's better if you know what to do for yourself so you can take care of it without having to come into the hospital or the doctor's office. And most of the time, most back pain is actually treatable symptom management. That's what we're doing. We're making you feel better so your body can get better by itself.
For patients with back pain and no leg pain, very few of those patients need surgery. In fact, I'd say none of those patients need surgery. There may be a very small minority for whom surgery would lead to a better outcome than non-operative treatment, but again, it's very hard for us to predict who those patients might be. For patients who have back pain and then develop pain radiating down their leg, any numbness or weakness in their legs, those are all signs and symptoms of nerve compression. Those are patients who might benefit from surgery. They're also the type of patients when they see their primary care doctor, if those are the symptoms they're having, it's appropriate to get an MRI in that situation so we can document and diagnose where the nerve compression is occurring and try to determine if surgery would make sense.
I think people have a misconception that we can do more than we can sometimes in medicine. We can put people on the moon and we can send spaceships to Mars, but how come we can't make our back pain better? Or why isn't there something fancy and snazzy that we can do to make it better? And you know, it's interesting, but most of the time you have the power to make yourself better, and that's pretty cool when you think about it.
This Healthy Highlight is brought to you by Dartmouth-Hitchcock and Ledyard National Bank, working together with our community partners to improve your well-being.